As the number of COVID cases increases in Nashville, more people will need to quarantine. But what if you don't have a home where you can isolate safely?
New at 10, News Channel 5's Emily Luxon explains why some say more needs to be done to make sure homeless residents who test positive for COVID have a place to go.
More than 40 homeless residents are now living at this former jail after testing positive for COVID-19 earlier this month. The CEO of Neighborhood Health, Brian Hale, calls it a distressing development.
Whenever you use any kind of environment that has correctional bars and it looks like a jail, that's really triggering for a lot of folks who have a history of psychiatric illness.
Hale says Neighborhood Health has screened several people with COVID symptoms from the rescue mission and helped those who tested positive.
We made sure that everyone that we tested moved to a motel, to a place that was appropriate for them to isolate.
After a string of positive tests at the rescue mission, officials say the Metro Health Department tested around 600 people at the facility last week. Individuals who tested positive or had been in contact with someone who tested positive were then moved to the Old Core Civic Prison facility on Harding Place because the rescue mission doesn't have enough space for everyone to quarantine safely. Hale believes there are better options.
Most other jurisdictions have a plan in which they use motels where there's availability, and if there's not availability, they rely on large-scale settings like community centers or something like that.
A spokesperson for the Nashville Office of Emergency Management says the old jail is being used as a temporary overflow shelter, and other undisclosed locations are being used as well. He added several Metro agencies have been in ongoing discussions on how to successfully house the positive cases. Hale says a solution that protects homeless residents and keeps the entire community safe needs to come soon.
We know we can do this, but we have to work together.
Emily Luxon, News Channel 5.